Hello everyone, today we'll be learning about the C-clasp or the circumferential clasp. So the armamentarium required for fabricating the C-clasp is the cast, a small piece of wire which we have to straighten up, and the universal plier and a marker. So first we have to take the cast and then we have to fabricate the C-clasp first by engaging the wire along the cervical margin of the particular teeth. So we'll start making the U. Check if it's fitting properly. So once you make sure the wire is seated nicely in the cervical margin, but there will be a small gap in the interdental region between the wire and the tissue surface. So in order to engage the wire properly in the interdental area, here you need to give one more bend, that is called as step back bend. So what you have to do is you just have to mark in the interdental area where there is gap, and then you have to give a forward bend. So hold the wire and give a forward bend, that is away from the tooth surface. And so this will make the wire to seat in the interdental area properly. So once this bend is given and the clasp is seated nicely, then you have to mark at the for the occlusal bend. Cut off the excess. Once the wire is seated properly even in the interdental area, start marking the palatal bend. And once you have given the palatal bend, give the retentive tag at the end. There is little more gap between the wire and the tissue surface. We will adapt it. So that's it. Thank you.